Hello and welcome back. This is Dr. Jerry Cuomo. I'm here to go over the Class 2 preparation on tooth number 12 now. It'll be what we call distal occlusal tooth surface, where the dental caries or tooth decay may have started on the distal aspect of this tooth. So again, what we're going to do is put this in the model and draw our gingival line, but before we do that, let's go ahead and color in the occlusal aspect. Now we're going to have two dovetails to put in on this tooth, different from the molar. So we'll have two depth cuts, one on the mesial aspect here, one on the distal aspect here. So let's get started. I have my 699 carbide burr in, and I'm going to go with two notches to the right, or number 4, and we're going to go about 1.25 millimeters, so just a little less than half the distance of the tip of this burr. And I would highly suggest that you measure it with the periodontal probe. And you get to this point here, we just stay with the long axis of the tooth and turn it around. I'll prep that in a little bit more. Perfect. Now you want to connect the dots so you have those two there. I might deepen this one just a tad. Perfect. I'm going to move my microscope closer to my vacuums, make my life a little easier. There we are. Okay, and now let's connect the depth cuts. Now I've seen some of you kind of go along the top and do this. I would recommend just don't push vertically, but pull it, and you'll save time. And I'm not worried about having it a little too deep at this point. You should be okay. And just connect the two. Alright, so I'm about 1.5 millimeters in depth. Now I'm going to go ahead and trace out my dovetails, again staying with the long axis of the tooth. We're using a 699 burr, and then we'll go back in with a 556. Alright, so now if you really look at the side of the tooth, you'll see it angles this way along with margins. That's kind of how you want the internal mesial wall to be. Again, with a 699, it is tapered, so be very careful you don't start opening this up too much. I'm trying to stay conservative with a small diameter. Now you're going to start on the other two dovetails before we drop the box for the Class 2. There we go. And our checkpoint today is how well you did a Class 1. Okay. So now I'm going to stop and switch to my 556. And I'll do that now. Turn my machine off. 556 has a little larger diameter. And so you're going to feel the difference right away. I just let the burr do the prepping. I really don't like to push things too far along. Let the burr do the cutting. They're pretty sharp. You don't have to push this too hard. Alright, so here we go. 556 in hand. Now I'm going to use a pencil grip. I want precision here, so here's my grip. There are my fingers. And here's my prep. Now it's a little too light for reflective purposes, so I got to take it up to higher magnification. Again, I'm just going to drop it in there. Let just go straight in. You'll feel more cutting at the base of the pulpal wall. I might be a little too deep on this one, but this is just for demonstration purposes. We're going to assume that we have drawn our mark a gingival mark. I'll actually show you that in a little bit. Okay, so I'm rounding internally all the little line angles. You got a nice key lock there. And we'll open it up just a little bit more. There we go. All right. Looks nice. Come up this way. And this way. And as I did with the molar, we're going to get rid of this wall here. So just go straight out with it. Now that you've got your dovetail produced as your class 1, I'm just starting to move this prep so that now we can get rid of the distal wall. We're going to make this a class 2, so let's keep going. So class 1 is just a mirror image of that mesial. Class 2, now we have to go down and make a stair, like a step. And as I stated before, we're going to have a little S contour on the distal buccal aspect, and on the on the distal lingual aspect, it's going to be straight line 90 degrees to the surface of the tooth. Now it's getting thinner and thinner. Notice I'm not pressing down at all. I'm just coming straight out laterally. There I go. Just be careful. And I'm just using the side of the burr just for teaching purposes. Of course, in the mouth you can't do that. So let's extend this out. Again, don't use anything high here. No need high speeds, just low speeds. All right. So there's the first part. Again, I'm going to switch. I'm going to use my thumb, and I'm really going to get some fulcruming here to cut this. And notice if you look straight down, my pulpal floor is very clean. And we'll look at it at a higher power. And very flat. Okay, so our step now, we're going to measure for that. Before I do that, I'm going to finish my occlusal design of the box. So I want my S contour. Let me go over that. Distal buccal S contour is going to come up to right about here in the shape of an S. This is going to go straighter and be more at a 90-degree angle. So it's really going to open up the box area, and then we'll drop it down to the gingival. And I'm staying parallel to the long axis of the tooth. You hear me saying that constantly in class. Very important. And for my demo, I want to get this just right for everybody. So here's my nice straight 90-degree on the lingual, just like it is in your diagram in your handout. And then S contour here. A lot of my preps I do today really don't copy this as much. It is in the back of my mind, but a lot of times tooth decay doesn't permit it. So this is basically ideal, and that's what you'll learn in dental school, hopefully, that everything's still taught that way. I'm sure it is. Okay, so there's my S. Here's my straight line. And I'm a little convergent. I want to stay parallel, so I'm going to just straighten out my burr, lock it in. Great. Now I want to drop my depth. So about the depth cut, I want to say it's going to be equal distance to that of the occlusal portion. So I'm going to go ahead and mark this, and I'm going to come back with the next segment, and we'll go ahead and drop the box. This is Dr. Jerry Cuomo on the Class 2, tooth number 12, which is the premolar preparation, or bicuspid. Take care.